Well, thank you to Healthy Villages, to Aptus, to Healthways, to RFK Human Rights, and to you, Donato. It is humbling to receive this award and a joy to celebrate your 5 years of progress. I have witnessed firsthand the evolution of Healthy Villages. We see in friends like Wycliffe what happens when healthcare providers in a rural place are given access to diagnostic tools and reference materials on mobile devices. From my vantage point in Lwala, Kenya, we experience the commitment of Healthy Villages through your actions, bringing internet access, expanding a hospital to reach more mothers and children, building clinical staff housing, and recently mobilizing a new health e-vehicle to help us reach more members of the community. But none of that work will be durable without strong community organizations like the Lwala Community Alliance and committed resources from you and committed advocates who are willing to walk in solidarity for the long haul. The world is going to keep moving faster and continue to tempt us to abandon commitments. Smart watches, quicker apps, and the speed of consumption fool us into thinking that transformation is fast. But for the last decade, Jenna and I have had the unique privilege of working for health and development in last-mile communities in East Africa, and we have been humbled to realize that the amount of time that is required to see true transformation through. There are still truths about the world that we ought not ignore amidst the sheen of the immediate.
If you look at the amount of time it takes in Africa for corn to grow, or for a girl to walk with her bucket to the nearest watering hole, you find that the pace of life and the growth of people follow the pace and growth of the land. Or if you're witness to the achievement of a community coming together to build their own health facility, only to realize they do not have the funding to buy medicines or pay their staff, you begin to expect a slow-paced and uneven path in all things. And as we continue to champion the good work of community health around the globe, that path will be the same. In Kenya, they say pole pole, or slowly by slowly. In Zambia, they say panono panono, brick by brick. And they're not referring to just speed or pace, but also that uneven up and down, 3 steps forward, 2 steps back nature of both work and life amidst challenging circumstances and broken relationships and deep-set cultural constraints. There's never an expectation that life will go smoothly or that you will reach your destination with expediency. Slowly by slowly expects ebb and flow, and it sees healthcare happening in the midst of overwhelming sickness. It brings 10,000 liters of water, even if 100,000 are needed. Brick by brick, there are hospital wings built and mobile devices deployed, and yet many children under 5 still do die. So slowly by slowly, we expect to wage the long defeat and seek after true transformation in the midst of a nearly blinding brokenness.
Let us remember that the works of justice are long and suffering, both for the individuals who are today enduring the brunt of the world's worst injustices, and also for those of us who are committed to moving the needle. Dr. Martin Luther King Jr. rightfully noted, human progress is neither automatic nor inevitable. Every step toward the goal of justice requires sacrifice, suffering, and struggle. It requires the tireless exertions and passionate concern of dedicated individuals. And he would know. Our pursuit of justice ought not be a sprint, and real change happens in stops and starts. Accomplishment, it mingles with failure. And we need to give ourselves permission to accept that in this work, because we will experience both. We had once thought that hope was easy. Belief in the good came easily to us. Now we realize it was passion that came easily. When we were young adults, our passions were a gift. They propelled us forward. But at some point, the wind disappears and hope must take over while you wait, expectant in still waters. True hope is always hard. It is not passive wishing. It is an active exercise, a choice, an intention. Hope means giving up apathy and despair and instead embracing that uncertainty that terrifies you. It is the sacrifice of keeping your heart soft. It is the determination to stick with it even if you may not succeed.
When I was in high school, my classmates voted me most likely to devote my life to a lost cause. And some days I take it as a compliment. But the thing about lost causes is that they're only lost if you leave them behind. And because of resistance, you may want to write them off. But if you stay in there, and if you keep hoping in action, if not in feeling, you may discover they're not lost after all. You may discover that they're the most beautiful, extravagant examples of abundance in your life. And you may start keeping your eyes open to causes that seem the most lost of all. But it is not easy, and it is a slowly by slowly experience. And so we are so grateful to Donato and the Healthy Villages team, and to you, the community of support, who are making a stand tonight in solidarity with the countless communities who are championing the true and lasting change in their own homes and villages. We are humbled by this Community Champion Award. We accept it in honor of our friends and community partners across sub-Saharan Africa who inspire us to keep at it with them. Thank you.